So everyone knows how dramatically and swiftly healthcare changed over the last 12 months. There is so much to be excited about in the healthcare space right now, both as humans and as communicators. So we're actually breaking down our next session, which is our keynote, into two parts. So I will start with a 15-minute rapid fire Q&A with W2O's founder and CEO, Jim Weiss. Before I go into that, though, I want to do two quick housekeeping notes again, just to remind everybody that you can ask questions in the chat. So please feel free to kind of be as open as you want there. And then, of course, also the hashtag ProvokeNA to follow there. So going back to Jim for a moment, when the pandemic first took hold last year, Jim was actually one of the first industry leaders that I wanted to speak to. He's been on the front lines of healthcare revolution for 30 years. And so part of this rapid fire Q&A, he's going to talk to us about some of the breakthroughs that he's most excited about. Then we'll invite on stage Terry Sanders from HIMSS and Salesforce's Dr. Geeta Nair, and we're going to continue the conversation more broadly looking at some key healthcare trends. Welcome back, Jim. So great to have you back on our stage.
Hi, how are you, Aarti?
Good, good. We are maybe the first West Coasters on the stage today.
Nice.
Or you're probably the first West Coaster on our stage today.
It's not that early either. It's nice out.
No, not anymore. Not anymore. Yeah, no. Let's not rub it in to our East Coast friends what kind of weather we've been having here lately.
All right.
So Jim, when we spoke last April, right, the pandemic had just sort of taken hold in the U.S. Our lives had just changed. And I remember at the time you said that there was no COVID-19 playbook. So now we're a year or nearly a year out. Would you say that we have one now? And what are some of those key lessons?
Well, it's the playbook that many of us have been running, which is, I think take it one day at a time in many ways and be prepared for anything. That's how many of us have gone about it. Running offices and large and even small organizations. And, you've got to be kind of ready for anything. But I think we've also learned that we can do more than we thought we could, right? Than the beginning would have told us in terms of doing, sporting events and many of the things you've seen taking place. So, many things have returned to relative normalcy. We had, a Super Bowl and an NBA championship and golf tournaments and lots of other things have taken place. We've also learned that you can go in and do some elective surgeries. You can get, preventive medical testing. And then, we're going to talk about this, but now, you can address your mental health issues, through the telemedicine channel. So there are some things that I think enable us to interact and we've learned so much. And I think the world has changed forever in many ways, maybe for the better.
Yeah, and so to your point about telehealth, at the Digital Health Virtual Summit last month, I think you said we are now entering the true digital healthcare revolution. Yet, I think it was just 5 years ago that Dr. Sue Desmond-Hellmann called the state of digital healthcare, I think her quote was pitiful. What changed?
Well, I always say, sort of necessity is the mother of invention. And we really ended up in a place where we had to come up, all of us collectively, individually, had to come up with solutions quickly. Some of the solutions were there and ready to go. We just hadn't put them into practice. I think you and I in talking in our prep sessions, whoever would have thought that grandmas and grandpas and others would be making appointments online for vaccinations. And now they can probably buy concert tickets when we return to that normalcy. But who would have thought that they would have been able to use apps and download them? And, there was a lot of teaching going on over the last several months in particular. But I think because people had to learn how to do that in order to communicate and, be with their loved ones and stay in touch and learn about what's going on, we had to buck up and do it.
So one of the
So
things
that brought the
that,
rush.
yeah, and I mean, and there's been so many great things that came out of the pandemic, but also, I mean, COVID-19 exposed in the US especially how sort of inadequate our public health tools and resources are. What role do you think communications can play in improving our public health readiness? Not, I mean, just, for this pandemic, but also for the next one.
Well, I've always said, communications needs to be right at the center of the marketing mix. It's never been more important since we've had social and digital media. We're going to get into misinformation and disinformation, I know, in our panel, but and sort of the overuse of those things and where that's led us. Obviously, any overused strength causes problems as well. But, I think communications is leadership. Leadership is communications in today's world where you've got to really help get the right patient on the right treatment at the right time. The notion of communications is central. It's the tip of the spear. It's the center of the marketing mix. It's the leading, player. And I think those that think with the end in mind recognize that one tweet can really change the course of a business or a situation, are the ones that are leading the way in any market.
Yes, one tweet can change the course of a business. Let's talk about healthcare inequities. I think the vaccine breakthroughs have, of course, been miraculous. And one of the things that stood out to me was the clinical trial recruitment. So I know that Pfizer increased the number of people in its clinical trials to ensure an adequate number of people of color. I think they went from a 30K sample to 44,000 in their study. I would think comms would be highly involved in achieving an outcome like this.
Oh, it's totally critical. Data and analytics are critical. We have our own algorithms and programs that help identify and target, those patients and, get people enrolled. Obviously we talked about, vaccine confidence. We're working with, lots of different organizations, including the Black Coalition on COVID. A lot of mobilization has occurred in the space, but yes, communications is central to educating people, again, about where and when and how to do this. I do want to make the point that this is, somewhat unprecedented, like everything else in this pandemic in history, to develop a vaccine this quickly, or, any therapeutic intervention like, the antibodies or the antivirals. All this was developed so quickly. Normally it takes us, 5-10 years to do that? And then 5 and 10 years to deliver it and get it out there. Again, communications has everything to do with the acceleration of all of this, and the urgency is what has driven this.
Right. So sort of on that note, I mean, are there any other ways in which you think sort of this digital health revolution can expand access for marginalized communities and also, so there's communities of color and also, rural communities in the US as well?
Well, the first thing we've got to do, and there's efforts underway to do it, is to get everyone, more equal access to broadband. And, I think 5G will, again, revolutionize this. So the tech companies do play a big role, and telecom companies play a big role in this. And I always said, I've said this before, and trying to get people to come work here, that there's nothing more important than your health. And health is described in many ways. And there's, health that is related to, these points of access and education, having access to, wireless and, Wi-Fi and all these things is what is the gateway in. Now, we are going to talk again about the pros and cons of social and digital media and where that can lead you, right? It also opened the gates to mis and disinformation. And how do we now deal with that? And you've seen all the various Netflix documentaries about the pros and cons of social media and what can happen. But I think at the end of the day, getting this access out into the community, and it is the purpose of my firm, to ensure that, we really communicate accurately to as many people as possible to make the world a healthier place. And that's really, I do believe you can do that through communications.
I want to ask you one question specifically then about recruitment. Over the last 12 months, have you seen sort of a boom and folks wanting to work at an agency like yours? Folks who maybe have never worked in healthcare before, but have said, you know what, I thought technology was going to change the world, but actually it's healthcare. Like, are you hearing that from folks?
We are, but I think it's both. It's what you asked about, or the first question was that convergence. I mean, there's been this wrestling of how tech can impact this most difficult of areas to impact, because it's seen as so complicated and there's so many stakeholders and players. And I think at the end of the day, if you really put the power in the patient's hands and the people's hands, whether it's related to their own data, information, all that, I think we're going to see a major revolution. So I think people are feeling like, oh, we've got to do this also more creatively, through content, through data and analytics. I think people are realizing because of the pandemic that, everything is healthcare. If you don't have your health, you really can't function. We're seeing medical directors and epidemiologists. One of our panelists coming up on the panel has been a medical director at public companies for years. It's interesting to hear about that role and how important that is, because again, is this the first and last pandemic? No. And are we going to have other environmental and other issues that we're going to have to deal and wrestle with and be prepared for in the future? Yes. So I think a lot of folks have seen the opportunity to come into firms like ours or companies we serve as a real opportunity.
So I think we have enough time for one more question before we open it up to the other panelists. Digital therapeutics, what's the most exciting breakthrough you're seeing on this front, and what kind of demand are you seeing from patients as well?
Well, I mean, I think I'm particularly excited about things that are, helping with the mental health issues in crisis, because I think that's one of the most underserved, underappreciated areas. And I had someone come to me, in the middle of all this, asking about, the stigma of mental health and how we destigmatize it in the media. And I was saying, well, don't you think this has sort of busted that open, this whole pandemic? And I think all of this access to, not only the telemedicine, but you're seeing, those providers adopt, digital solutions, payment solutions, and other means that I think are really going to open things up. And look, if you can address that one and you can get, people kind of on a sound mental footing, I think a lot of the problems we were seeing pre-pandemic, which was high rates of suicide, especially in teen populations, this would be a pretty magnificent breakthrough due to, digital health proliferation.
So that's a good segue to open up this panel, because we will talk about mental health a bit more with the wider panel, and also I think you referenced misinformation and disinformation, which we'll also address. So with that.